Asthma is a chronic long-term lung disease. It affects the airways that carry air to and from your lungs. Inflammation causes the airways to become narrower and they produce lots of thick mucus, which makes it hard to breathe.
Why some people get it and some don't is unclear, but it is assumed that it is a combination of environmental and genetic factors. It is the most common chronic disease among children, more likely so if they have a low birth weight, they're exposed to tobacco smoke, are African American, or raised in a low-income environment with limited healthcare access. As you grow up, if you have allergies, are overweight, or have eczema, you're also likely to get it. Symptoms typically begin to show around 5 years of age.
This can be diagnosed with a lung function test, medical history, and a physical exam.
In children, boys are more likely to have asthma, although through adulthood, females are more likely. 13% of African American children have asthma, and this compares to 8% of Caucasian, 8% of Hispanic, and 12% of American Indians and Alaskan Native children.
Symptoms include frequent cough, especially at night and after exercise, losing your breath easily, feeling very tired or weak when exercising, chest tightness, pain, or pressure.
No cure for asthma, but it is possible to control it by having your doctor help you make sure there are no other conditions that interfere with your asthma, avoiding asthma triggers like colds, pollution, and cold air. Even though physical activity is considered a trigger, you should still stay active in order to have a healthy lifestyle. Your doctor can help by giving medications. Asthma medicines can be taken in pill form, but most are taken using a device called an inhaler. This allows the medicine to go directly to your lungs.
You can control the severity of your asthma by not smoking and reducing your and your child's exposure to air pollution.
An allergist or immunologist is someone who manages pediatric and adult patients with medical problems such as respiratory tract diseases, allergic diseases of the eye, allergic reactions to food, drugs, or stinging insects, and many other diseases and disorders. A physician in this field can follow patients throughout their lives and also provide care to other family members who have the same or similar conditions.
Hippocrates, the Greek physician, first described asthma and its resulting spasms. Galen, a Greco-Roman doctor, discovered that asthma was due to bronchial obstruction. Many daily encounters can trigger someone's asthma, such as exercise, dust, stress, chemical fumes, and pollution.
An asthma attack is a sudden worsening of asthma symptoms called a bronchospasm. More mucus is produced than normal, and the swelling of the airways is significant. Since someone who has asthma has very narrow airways, breathing through a straw after physical activity can simulate what asthma feels like.